right, at this point, I want to invite Patty Higgins to come up to present the executive summary of our community needs assessment, and while she's making her way all the way up front. I just want to take a moment and thank Patty for her incredible leadership on this project. Patty's professionalism, thoughtful approach, and encouragement have guided us expertly throughout the last year. So thank you very much, Patty.
This is just a schematic kind of the process and also the product. Starting with the board that began this process about a year ago. A smaller planning nuts and bolts committee that sort of made everything happen and eventually ended up sifting a lot of this information with the editing and re-editing process. Working very closely with the 21-member steering committee, which is a wonderful reflection of the leadership and the commitment and the competency of folks in both of our communities that we're so lucky to be living in. The process centered around four components and a gathering of information and data that was both qualitative and quantitative. Quantitative data included a community scan, which is a statistical picture of both communities, a snapshot, if you will, using 5 forms of data. Much of it's publicly available, verifiable, replicable, so we can build on this in the future. We were also very lucky to be partnering closely with the police, the schools, and the housing authority for relevant local data as well. On the other end, there's the other quantitative sources of information that we included in the study, and that was the community survey that was alluded to, 658 completions. The survey we're very, very happy with and very proud of the outreach that we made it available in 4 languages. We made extra efforts through volunteers, many of you in the room here, at the libraries, at the senior center, at the community supper, at the food pantry, to make sure that anybody that wanted their voice to be heard had an opportunity, and that was through the survey. And 658 completed surveys means that we have a statistically significant sample for what people are feeling about specific issues that were covered. Yay! Touch. Okay. And then we have to. So on the outside were the quantitative data. On the inside, I'm going to keep going. On the inside were the gathering of qualitative data in the form of interviews. Here we go. Interviews with 35 experts in the field's various aspects of human service delivery. They were group interviews. They were individual interviews, mostly in person, some on the phone. And in addition to that, there were 24 additional experts brought in the form of focus groups, 4 focus groups, in areas where we needed additional information as we went through the process. So this qualitative, quantitative sort of sectioning of the data, it follows the same format in if you want to get into the detail and find out how exactly we came to the conclusions that we did. More about the methodology, again, if you want to go online and find out kind of the timeline of the process and how it flowed. My personal thanks, and I have to say I'm going through withdrawals because I'm not in daily contact with this awesome project team. And Alan Burko, Rachel, and Ivit, as well as Ann Budner and her team at Carlisle, which was this just magic coming together of really great thinking and talent and dedication and encouragement, as well as a great partnering with this wonderful steering committee and the rest of people that always said yes. So whenever we needed something, whenever we reached out to anybody in the community, they said yes. And that's just the nature of where we live, and aren't we lucky? And isn't that an incredible reflection? And that includes the business community. It included people from all walks of life, not just people that dedicate their lives to human services, but really this coming together of, people that really care about where we live and wanting it to be the best place, and making sure that people who need help are going to get the help, and making sure that we've got services and a network that's going to provide that. So lots of people to thank. We have them individually listed in the appropriate areas of the larger study. Too many to name right now, but thank you to them as well, and the steering committee, which is listed also in your pamphlet program tonight. These folks, some of them are here, and really wonderful, insightful leaders and dedicated professionals and volunteers that we partnered with and that really helped to guide this whole process. So that's kind of a little bit of the background. Now what I would like to do is start getting into some of the findings. The next 3 slides, we will talk about kind of themes and trends. And this is things that sort of we heard a lot about no matter what issues we were talking about that applied across the age spectrum. So then we'll get into individual findings by age group, by the 5 age groups. So I would just encourage you to think about the themes as backdrops to everything, all the other issues that are then talked about in the age population discussions. Okay, so the themes, kind of the statistical picture of what's going on in our communities. Some of it surprising, some of it not surprising, very obvious in our day-to-day world, but the statistics and the data back up the idea that we are a stable population. We haven't grown or exploded by leaps and bounds since 2000, for instance, but it's a shifting population and a changing population. We are very diverse. We're very international. Over 25 languages spoken in the homes of high school students. We've got upwards of 20% of the population now originates from Asia, mostly China and India. It becoming more and more diverse. We are on the map for the rest of the world as an attractive place to live, and we attract families really from all over the world. We're getting older, and not just, as individuals here. We are, the 65 plus population is, I've heard, as high as the recent estimates at 17% of our population, and becoming increasingly a greater proportion of the folks that live in our towns. That has profound implication for the services and for the kinds of infrastructure and the future planning for our towns. We're highly educated. Close to 80% of adults in town have at least a college degree. We are known as a prosperous community. The top income levels, the number of households earning more than $200,000 per year are becoming more numerous and similar to the rest of the country. The middle folks between $50,000 and $200,000 are somewhat less. A very consistent percentage, though, is between 20 and 25%, but almost a quarter of our population live in households that make less than $50,000 per year, which may or may not be surprising to some people, but that is a significant portion of people that are our neighbors. Okay, so now that's a little bit of the statistical snapshot, right? That affects sort of everything that goes on, including our human service network. We next sort of kept hearing things about our infrastructure that affect all kinds of service delivery issues around housing, the 3 A's, that there isn't enough adequate, affordable, and assisted housing. Came up again and again. It affects families, it affects seniors, it affects everybody in between. Transportation kept coming up. Now I know it's a hot buzz thing, there's lots of progress being made, lots of talk and discussion about it. For the purposes of vulnerable populations though, transportation is tricky enough if you have an able body and an able pocket, right? But if you are disabled and you're economically squeezed, transportation makes your issues that much more complex very, very quickly if you can't access services because you can't get to them. The schools, which are this crown jewel in our community that we're so proud of, they are working as best they can to meet the needs of a quickly changing population. The school population is not necessarily increasing, in fact is probably decreasing a little bit, especially for the younger kids in the elementary schools. But it's more complex because there's economically squeezed families, There's kids that have language and cultural issues. There are other complexities that are happening at the junior high and high school levels that make this really wonderful asset in our community under pressure in many ways. The other infrastructure discussion that kept coming up a lot was around public safety, which we assume, oh darn. So discussions around public safety, and it's wonderful to know that it's such a safe town, but what we were hearing an awful lot about is that the resources and the focus of the pressures on public safety are around increasingly human service focused issues, mental health and substance abuse and domestic violence and protecting seniors. And this is not traditional police work, but the infrastructure has to react and has to be of service and as part of this overall picture of how it affects people's lives. Okay, so we've got infrastructure, we've got statistics, and a demographic picture. And then sort of the third sort of group of overall themes is around just in conversation, in statistics, what we kept hearing. And stress, unmanageable, overwhelming stress was, of the 32 issues we asked residents about, 4 of them were in the top 10, top 8 actually, regarding stress. Unmanageable stress for teens, for families, due to technology, the ubiquitous nature of technology. So this is a big part of the conversation. We tried very hard not to repeat ourselves in the age group discussions, but we broke a lot of rules with this one just because it was so prominent, the stress issue. This issue of lack of connection and disconnection, especially when people are in trouble or people are in need of each other. We are in this beautiful suburban, green, lots of space kind of, that's why many of us are attracted to it. But there was a lot about this discussion of, we want to be connected. How do we remain connected, especially when somebody's under stress or somebody is suddenly isolated emotionally, but geographically as well. And so Rachel also alluded to this theme, which is the lack of information, and that became really clear in this survey with the residents, who said of the 32 issues we asked them about, just about all of them, about 40 to 60% of the respondents said, yes, I would know where to turn for help for this issue, which means 40 to 60% do not know where to turn for help for a specific issue, right? So we have a long way to go on that. What also was so striking to many of us as we were having these discussions around the table with people who are experts in the field, they have their world and their aspect of expertise. But invariably in our discussions, we saw in action an exchange of information of, oh my God, I didn't know that, and oh, how could I refer to that program, or oh, there's openings for that, is there? So there was almost an education process in the form of these discussions that sort of, so it's providers, it's people that are in the field, not just residents who really have a lack of knowledge of where the resources are and where the networks are. And then finally, across the age spectrum, there is just this reality of what I'll call help-seeking aversion. And maybe it's the senior that is afraid of losing independence. Maybe there's a cultural issue, a shame factor. Maybe it's a personal decision or it's a denial of a problem. But there is, across issues and across age population, just this real, maybe it's the New England cultural thing that we are all sort of an island unto ourselves and don't need the help. So that's backdrop, right? So that sort of can apply in a general sense. We then worked very hard to sift the information in the data, that's this qualitative and quantitative data. Just a little bit on format here. The 5 age groups are children, teens, adults, families, and seniors. And each of these in the discussion for tonight has 2 pages dedicated to each age group. Across the top is some trending and demographic observations. The middle are the major primary areas of concern. The barriers to accessing help is part of the complexity of the discussion. And then the second page gets into more specifics around the areas of concern for that particular age group. There's no significance in children being discussed first and seniors discussed last. It's just sort of how we decided to present across the age spectrum. Okay? So for children, we chose to talk about technology concerns and the stress due to technology because we heard that this is a concern for younger and younger children, right? The world is in their hand, and that's good and bad. And parent perplexity around how to protect children and how to parent in a very fast-changing environment with high risks, exposure to things like bullying, inappropriate content, all kinds of parenting complexities that make me very grateful that my kids are pretty grown. Then the challenges at school, which we touched on a little bit, affecting families in profound ways. It affects the infrastructure and the school's response, but also there are families that are struggling with kids that have special needs more and more, the diagnosis, and how do we as a community support that. The language and cultural considerations. The technology concerns, again, there was a sense of wanting to have parents be part of the solution, but not quite having the infrastructure or the knowledge how to provide parents with the ability to protect their children appropriately. And then child care challenges, especially for the economically squeezed families. That's an especially, it's tough for all families, but if you don't have money to pay for your child to make sure they're safe after school or during the summer, it becomes a critical problem for those families and young children. Teen findings. It's not surprising to see that high stress, we mention it again here, the mental health issues and the substance abuse issues rose to the top. We heard a lot about it. What's interesting, what we chose to do was talk about alcohol and cannabis with the teens, and we talked about another very serious aspect of substance abuse, which is the opioid crisis in the adult population. We talk about that a little bit more there. So the issue of high stress and where it comes from is definitely part of the conversation. The substance abuse, and as far as alcohol and binge drinking, and a lot of discussion around how that affects teen behaviors and risks. It was very interesting to see that the residents ranked alcohol as a much higher concern than the actual providers, and the providers were absolute, hands down, top priority was the opioid crisis, in their opinion. So there was a big difference there. The mental health concerns are a little bit eye-popping in that there's escalating incidences of teenagers, high school kids, being admitted for psychiatric purposes to the hospital for some very serious issues that range from eating disorders to suicidality to self-injury. We found in the conversations there's a real lack of aftercare services. We do great with the emergency, not so great with services and support to families after the crisis is over. So a lot of recycling that happens, re-escalation, and going back into an emergency situation. That was a significant part of the discussion, certainly not the whole discussion. You can tell I'm really galloping through this stuff. So in adults, this is where we gave some attention to the opioid crisis. We talked about the involuntary hospitalizations that the public safety officials are having to deal with more and more, and are in fact only just in the past few years tracking it because it's become such a more and more central part of their work. And then we gave some special focus to this segment of the adult population, which are young adults, 18 to 25, who we legally call adults, but neurologically they are not adults. We now know that until they're 23 to 25. But they're protected through privacy laws. If they're in trouble, it becomes more difficult to help them. They are targeted in ways by drug dealers, for instance, that other populations are not. And so they are a population that have special risks. And the opioid crisis will definitely make a lot of us uncomfortable. And we hear a lot about, Governor Baker and his new initiative, and Marty Walsh and his task force, and I hope that doesn't at least lull us into the idea that this is an urban problem, because it is not. It is here. It has roosted in suburban communities, and you just have to look at some of the statistics. 40 overdoses in Acton since 2012, 5 resulting in deaths. So, unfortunately, it's here. The opioid and prescription drug crisis is part of what goes on, and if we don't know somebody or know of somebody, we unfortunately probably will, sooner rather than later, that's had this tragedy happen to them. We also, again, see this in the mental health discussions. There is a lack of providers, there's a lack of aftercare, and this is a real problem for people who are dealing and managing with mental health crisis, but then managing mental health over the long term. And again, focusing on some of the young adult issues, 18 to 25, our community does great for a lot of age populations, but that one in particular, we don't necessarily target many services, much outreach. It's kind of a hidden population, and which is another reason why it sort of rose to the top, and we heard a lot about the potential risks for that age group. Families, again, this stress issue. Where does the stress come from? Well, for all of us, we can define it differently, but the number 2 concern for residents is financial. It's paying for higher education. And that is something that was across the socioeconomic spectrum. Didn't matter how much money was in the household, but this was a financial squeeze and a concern for residents. The other discussion was around what we're calling vulnerable families, that there are veterans and economically unstable families that are financially squeezed. Domestic violence, if you think about it, over 200 calls in Acton per year means that there is a domestic violence incident that involves the police more than every other day in our town. And vulnerable families means, it's not always an economic vulnerability, but quite often that makes the challenge of daily living that much more stressful. And it's, again, very easy to overlook. We heard that in anecdotal comments a lot in the survey about how easy it is to forget how much a quarter of our population struggles to meet basic housing needs, basic transportation needs, basic food, and meeting daily living kinds of necessities. The housing, if it's not appropriately sized and accessible and affordable, that doesn't seem very, very feasible to remain independent and in the community. The safety issues that came up around seniors in particular that we heard a lot about were fraudulent scams that unfortunately we've all experienced it. Maybe some of, every day you're picking up the phone or you're doing your emails or and there's a lot of sophisticated perpetrators that are behind these scams, and unfortunately the seniors are targeted, and the police are tracking incidents, increasing numbers of incidents of seniors being defrauded in our community of tens of thousands, sometimes hundreds of thousands of dollars. The other issue we heard a lot about, and there was among residents, it ranked the absolute lowest issue of people knowing what to do if they had a loved one that had a health and safety issue involving hoarding. They wouldn't know where to turn for help. service providers are struggling and starting to educate and starting to get training in how to respond to that health and safety issue. It tends to be among the senior population, not always, but we included it in this part of the discussion under seniors. And of course, health issues, again, if you want to stay independent and stay in place and you're on a fixed income and the services that will allow you to stay independent and in place are not affordable, that has tremendous